This idea of taking a vaccine and then taking another one and get COVID-19 and then take another vaccine and then get COVID-19 again, right? Just keep doing it. Just keep doing it. It's absurd. It's diabolical. There's pictures of people wearing masks in swimming pools, people wearing masks driving alone. The American public has gone 2 full years and they've essentially been stonewalled on critical scientific advancements in the whole understanding of what SARS-CoV-2 is and COVID-19 illness. And what myself and people in my circles have done is we've gone to the public now through grassroots organizations in really what's a scientific reawakening, a medical grand rounds, if you will, for communities around the United States. And we simply go over the data, the published information about what do we know about the virus, what do we know about treatments, how can people avoid the catastrophes of hospitalization and death, and then what have we learned, what's emerged on the COVID-19 vaccines. Are they working? Are there hazards with them? How do people navigate forward in a progressively more restrictive type of sociological framework where people's lives and their careers are tethered to a vaccine? One of my 5 questions for the U.S. Senate is what can our government stakeholders, meaning the CDC, the NIH, the FDA, and the White House Task Force, what can they do to fully support doctors in a full-throated endorsement of doctors using the full breadth of their clinical skills and medical knowledge to not only treat patients with COVID-19 and prevent hospitalization and death, but to give patients a fair, balanced assessment of the vaccines and whether or not a COVID-19 vaccine should ever be considered or a patient to consider participating in the COVID-19 investigational program. It is between the doctor and the patient. That's the fiduciary relationship. We cannot have the fiduciary relationship be unsupported. What's happened over the last 2 years is we have fallen into a crisis of compassion, that we've had the confluence of science, we've had the confluence of medical response, we've had a confluence of various governmental agencies and governmental dictums, if you will, all converge on individuals. And what I hear every day is from people who feel vulnerable, and they feel as if there's been a loss of compassion within the family unit, and very importantly, a loss of compassion with respect to the patient and their relationship to their healthcare provider. And we must immediately restore those relationships. We must actually solve the crisis of compassion. In medicine, what we do is we say, listen, is it biologically plausible? Is there a biologically plausible way the vaccine could actually result in loss of life? Yes. Just like the respiratory illnesses, yes.
I think it's unprecedented. I don't think we've ever seen the medical profession come under such sharp examination. But what really is the horrifying aspect of it is that we're doing it to ourselves. Literally, the medical profession is cannibalizing itself. I remember when I was a med student and a resident, we'd go to grand rounds. That wasn't a time where we sat around and held hands and sang Kumbaya. It was a time of intense scrutiny. What was the best diagnosis for this patient? How do we best treat that patient? We work together to get to the best answer. Today, we're seeing one side of the physician aisle go after the other side with a vengeance. And it's going to fracture the medical profession probably for the remainder of my life. Tremendous amount of pressure on people saying, Doc, I'd love to be there with you. I'd love to stand with you. I'd love to support you in the words you're sharing, but I don't dare, because if I say a word, I could lose my job. I have physicians call me and they cry on the phone, feeling guilty that they're not standing more visibly with me. But I get it. I'm in a situation for such a time as this that I can stand here and be a voice. And I am not trying to be a voice for anything other than context and health freedom.
Censorship of scientific discourse, it's in the open.
Dr. McCullough, are you saying that the FDA is not for health freedom?
Well, just can you imagine?